in pharmaceutical giants spanning Bristol-Myers Squibb Co. to Johnson & Johnson and Eli Lilly and Co. are the first targets of President Joe Biden's historic foray into bargaining with drug makers to lower the cost of medicine. On Tuesday, the administration released the names of 10 prescription drugs that will be subject to the negotiating power of Medicare, the U.S. health program for roughly 65 million seniors. The government expects prices will be slashed by half on average, with the first cuts taking effect in 2026. However, investors took the disclosure in stride, and shares of most big drug makers rose at least slightly. Okay, so the group includes Eliquis, the blockbuster blood thinner made by Bristol and Pfizer, that's now the costliest on the list, to Medicare, accounting for $16 billion in spending in the 12 months through May to 2023, according to the government. The list also includes AstraZeneca PLC's Farxiga, which treats diabetes and heart failure. Now, they're so help them, but all of them need service for Medicare and Medicaid services. You chair the top of them, or if you're seeing the new and set and emerging seniors in the world, and I'm still over giving Medicare that remembered so much higher than an impactor finally. As a first thing you want to do with DICE, so California, which is a series of Biden's Inflation Reduction Act, signed into law a year ago in response to public outrage over U.S. medicine costs that are the highest in the world, mandated the negotiations. Other drugs subject to negotiated prices in 2026 include leukemia drug Imbruvica from AbbVie Inc. and J&J Amgen Inc.'s rheumatoid arthritis drug Enbrel, Merck & Co.'s diabetes drug Januvia, Novartis AG's heart medication Entresto, Novo Nordisk AG's insulin Novolog, and the type 2 diabetes pill Jardiance from Lilly and Boehringer Ingelheim. And J&J was among the hardest hit with immune drug Stelara. A surprise choice to some analysts, blood thinners are also on the list. The company also shares revenue with AbbVie for Imbruvica. J&J gained as much as 0.9% at the New York market open. Bristol rose as much as 2.9%, and the Standard & Poor's 500 Farm Index rose as much as 1.1%. And he said the IRA's policies put an artificial deadline on innovation, threatening intellectual property protections and shortening the time frame to deepen our understanding of patients' unmet medical needs. And J&J said in an emailed statement, the drugs on the list accounted for almost $51 billion, or about 20% of Part D's prescription drug costs in the year ending May 31. The statement said the release of the list sets up an escalating conflict between the Biden administration and the pharma industry that's suing to block the negotiations from going forward. The negotiation process is really focused on drugs that are very high spend, that are used pretty broadly. Centers for Medicare and Medicaid Administrator Chiquita Brooks-Lejeune said in an interview Tuesday, the law is very prescriptive about the way that we were to determine which drugs would be selected. About 9 million people on Medicare took the drugs selected for negotiation and paid $3.4 billion out of pocket last year, according to the administration. There's no reason why Americans should be forced to pay more than any developed nation for life-saving prescriptions just to pad Big Pharma's pockets. Biden said in an email statement, the medications already did discounts from negotiations with private insurers. The Pharmaceutical Research and Manufacturers of America Industry Group said in a statement, giving the government the power to purchase arbitrarily set the price would have significant negative consequences for years to come. Pharma Chief Executive Officer Stephen J. Ubel said, what Bloomberg Intelligence says, Johnson & Johnson Stelara being included among drugs targeted for price negotiation is a surprise and sets up potentially billions of dollars in revenue cuts beginning in 2026. Bristol's string, Eliquis, and Merck's Januvia were also tapped, but expected. Bloomberg Intelligence analyst Noin Wright, read the research here. While the near-term impact is unfavorable, we continue to be more concerned with the long-term impact of government price setting on biopharmaceutical innovation more broadly. Merck spokesperson Robert Josephson said in a statement packaged with a series of measures that address issues from climate change to clean energy, the IRA's drug policies are among the most aggressive ever to target the industry. I talked about this approved medicine. There's more to come too, with additional medications expected to be added to the list. And yet the extent of the impact on company results is the subject of heavy debate. The biggest hit to sales may not come for years, when the number of drugs being negotiated increases to several dozen. Meanwhile, the government projects that the price concessions will save Medicare $100 billion through 2031. Bristol is arguably the most at risk in this first round because of Eliquis, with Wells Fargo Securities estimating a 4% hit to annual revenue, and Pfizer's lower exposure and beyond social media to Eliquis means its total sales will only fall 1%. Sales of the rest of the medicines on the list are likely to decrease by less than 1%. Due to complete a very special system.
And that's what we have actually done, Nurse. The presidents that he can excavate went after 2.1.
Analysts from Wells Fargo and Cowen project what they described as a manageable impact of as much as 5% of industry-wide revenue. Companies are already launching drugs at much higher list prices so they can earn more before possibly facing Medicare negotiations, according to Evan David Siegerman of Emo Capital Market. That may end up undermining some of the benefits to consumers the IRA was meant to foster, although the 2022 law will cap other out-of-pocket spending and expand subsidies for low-income patients. The drug industry contends that the new law is price setting, not negotiation, and is suing to stop it. Merck, Bristol, J&J, and Astra have each filed suits that could set up split appellate decisions and fast-track the dispute to the Supreme Court. Meanwhile, the U.S. Chamber of Commerce is seeking an injunction to halt negotiations before they even start. The U.S. needs to file rebuttals starting next month. The laws on our side, and we're going to move forward, Brooksville Shore said, we hope and encourage drug companies to enter into agreements with us. But drug makers add that the IRA will reduce the incentive to develop new drugs, especially those for cancer that begin treating rare or advanced cases first, and then slowly expands into broader indications. That's because law shortens the time companies have to recoup their investments. So they focus on treating larger patient populations. Also, the Congressional Budget Office estimates that the law will reduce the number of new drugs coming to market by about 1% over the next 30 years, counting the effect of the price negotiations and other policies